The following paid program does not necessarily reflect the views of this station, its staff, or Clear Channel Media and Entertainment.
Live from downtown Honolulu, it's The Moving Body with your host, Dr. Bernie Portner of Portner Orthopedics, recognized as Hawaii's leading sports medicine and orthopedic specialist. And now, here's your host, Dr. Bernie Portner.
Good morning, Hawaii, and welcome back to The Moving Body, this time live on October 4th, 2014. The year is slipping by. We're in our last quarter of the year, it sounds like to me. October, November, December. Yeah, that'll do it. So, here we go. The show is now live. You were listening perhaps to the earlier show from 6 to 7, which was recorded earlier, I think much earlier. We got a whole new trove of old tapes from shows going back into the 90s. In fact, I was asked to bring in any of the recordings that I have so they could not replay the old tapes, and I actually brought in some on cassette tapes, for those of you who remember cassette tapes. And of course they couldn't use them. They don't have a cassette player anymore anywhere here, and all this equipment. I'm surrounded by equipment, but no cassette tapes. So those, I guess, are lost. Those, I guess, are lost to the ages. I think I have a caller on one, but should I? No? All right. 521-8383. Give me a call if you have any questions regarding arm, leg, neck, or back pain. We can talk about other general health and fitness issues, sports medicine, injuries related to car accidents or to work. And I am an MD with some experience in internal medicine and family practice. I suppose I could try to talk about non-orthopedic issues. From time to time we go there, but it's not exactly my kuleana. You know, we do have a lot of things going on in the news related to health, not the least of which is this Ebola business. We had a little scare, I think, at Queen's Hospital where a patient had symptoms suggesting a possible Ebola infection. I don't know how many of you heard about this. Let me start by saying it turned out not to be the case, so no panic. And we don't want to panic anyways. What went on in Texas is a little bit panicky because it demonstrated that we meaning we of us in the United States and perhaps the Western world and perhaps all over the world are ill prepared and not geared up to be on alert for possible Ebola patients. This guy came from, I think, Nigeria, or Sierra Leone, a country in West Africa known to have a big-time epidemic. He handled the body of a woman who subsequently died. He lied on his form when he left the country, saying he didn't have any contact with anybody. He came to Texas, got sick with fever, went to the ER, and they sent him home, even though he had traveled recently. And then 2-3 days later, he came back and clearly has Ebola after exposing over 100 people. So what happened there? Well, the symptoms were missed, and people traveling needs to be screened. And if this is going on in Texas, what about Brussels? What about Paris? What about London? What about Tajikistan, for goodness sakes? I mean, it's a problem. So, learn about Ebola. It's highly contagious. It's bodily fluids. You're not really contagious until you're symptomatic, which means you're sick. You're sick as a dog. You're not just feel like you're under the weather. You have high fever, nausea, vomiting, headache, stomach pain. Something is seriously wrong, and it's not it's not hard to miss. Although the hospital, the emergency room in Texas missed it the first time. So go figure. 521-8383. I'm not really here to talk about Ebola, but I can a little bit. I think we should all have some knowledge of it. Washing hands is very important. Keeping your distance is very important. Being suspicious is very important. And be careful if you yourself travel to these places or interact with people who have Ebola. It's a virus. It's mostly deadly. They're working on a vaccine. They're working on medications. And it's interesting. You can use the serum. That's the blood with the blood cells removed. You can use the serum from survivors of Ebola. Not everybody dies. So if somebody's infected with Ebola and survives, he survives or she survives because their body was able to mobilize and produce enough antibodies to fight the bacteria before they succumbed. And those antibodies are now floating around in the survivor's blood, and those antibodies could be useful to treat a person who's actively dying of Ebola. So there's a possibility of treatment. Of course, vaccines and direct antiviral drugs also offer some hope. This is way off base. If you just tuned in, this is Dr. Bernie Portner. I'm a MD specializing in medical, or that is to say non-surgical orthopedics. We've recently moved offices from Pi'ikoi Street over to Bishop Street just in the past month or so. I was over on Pi'ikoi Street since 86. Yikes. 28 years. But now we have new digs and really nice ones, and everybody's pretty happy. Great parking, a lot of nice privacy and space, and I'm very thrilled about it. We can take your calls 521-8383 if you have any questions regarding arm, leg, neck, or back pain. One of the more common conditions I treat, and one that you might want to call me about, is osteoarthritis, usually of the knees, although hips, thumb, shoulder, spine, fingers can all be involved in osteoarthritis. It's a common form of arthritis that affects the adjacent bones as well. So joints are two bones coming together, and with osteoarthritis, not only is the joint inflamed, but the bone on either side of the joint is also involved, and we can see that on X-ray. And we don't yet have a cure for osteoarthritis. We don't even think it's a single disease. It may be several different types of problems, all lumped into one because they look and behave the same. But there's tons of treatments for it, which means none are very good. And one of the treatments that I have been getting some medium-term, not short-term, not long-term, but medium-term relief, meaning 6 to 12 months, is using this Synvis Kyalgan type of treatment. And gosh, I keep getting calls and they keep dropping. Something else. And last week, by the way, I had the busiest day last week I had the busiest hour on the radio in terms of numbers of calls. I hadn't had that many calls since the good old days, whenever those were. I mean, we have 4 lines, and all 4 lines were busy the whole hour. Now the lines are fairly empty. Here comes somebody. But call now, because I had plenty of complaints. People tried to call last week and couldn't get through. Wait, I was talking about OA. So there are several treatments that can help, aside from various medications, physical therapies, cortisone injections, short-term. Longer term, medium term, we have this hyaluronic injection, this artificial lubricant that can be helpful. And we're dabbling with PRP, platelet-rich plasma, and stem cell injections. Those too can be beneficial. And we can talk more about that, as well as general preventative and rehabilitation type measures. However, let me pause in my talk of osteoarthritis, and I'll take my first caller. George, you win the internet. You win the prize. You're the first caller. Thanks for calling.
Hey, good morning.
Good morning.
I hope you're feeling better than I am.
Yeah, well, what's wrong? I can't hear you, George. George, we're losing you. I don't think we have a good connection. George, I'm going to drop the call, and you call back, and maybe we'll have a better connection next time. Sorry about that. George, man, he sounded like he wasn't that happy. Maybe he's going to call right back. Anyway, so osteoarthritis, when it affects the knee, it wreaks havoc in your life. You can't walk. It's painful to walk, so you limit your walking. And simple movements like getting out of a car or going upstairs or squatting or going to the toilet, getting out of a chair, is all with effort and pain, and it cramps your life, and you end up being less active. And when you're less active, you become less healthy. So while it's not your heart, it can cause serious problems with your general overall health. Just if you have a knee or another joint that makes it unpleasant to get around and walk. I don't know. This might be George again, trying to get through. Are we having problems here with our phones today? Don't tell me. Let me try this. I don't know. Here's George. George, you hear me now?
Yes, sir.
Sorry about that.
No, my line.
What's up?
I told you I have my pain in my left thigh, between my left knee and my left hip.
Yes, in the front of the thigh?
And yes, on the outside, yeah.
I see. And this is going on how long?
Oh, it's going on for 2 weeks now.
And is it
got a terrible bruise, a blood bruise up on the hip area on the outside.
Oh, what happened? Did you fall or something?
No, I was in bed and I got up and I jumped up light and found my foot down, and that's what caused me to have my first pain. Yeah. And
that's when you noticed the bruise that day or the next day?
The bruise came on after a while. Yeah.
So it sounds like you got out of bed so vigorously that you tore a muscle or something.
I tore a muscle or something.
Yeah, and it bled, and the blood finds its way to be under the skin, and it kind of turns bluish, and there you go. There's your bruise.
You're so right.
And if that's the case, just a massage. This happened how long ago?
Over 2 weeks. When I stand on it, I hurt real bad. It's like a tendon from the knee to the hip. That area.
That's a big area.
What?
That's a very long area from your knee to your hip. It hurts all the way up and down your thigh?
Yeah.
Oh, and does it hurt if you're just sitting?
No, just when I stand.
And if you take the weight off of that leg and put it all on the other side, does it ease up?
Oh, it's gone, yeah. The pain's gone.
So weight bearing is a big deal.
Correct.
And are you able to sleep?
Oh, yes.
It doesn't affect
you.
As long as you don't move. Well, geez, 2 weeks is a long time to have a torn slip of muscle be such a problem.
But I took medication and it helped it a lot.
What kind of medication do you take?
Ablation and Tylenol. And it helped, yeah.
And it helped.
But it didn't last long.
Do you feel like you're getting better, or is it staying about the same?
Well, it gets better, but then when I amble around, it starts hurting real bad, yeah.
I think it needs to be looked at, because we're just assuming you tore a muscle, which wouldn't be serious. It would just eventually heal. But a torn muscle shouldn't hurt if you stand still just bearing weight on the limb. That sounds more like a joint or a bone that bears weight and hurts. So it's such a bizarre thing to get up and suddenly have a pain that leads to bruising without falling or striking anything. What the hell inside your body broke or tore and bled? If it's a muscle, it should be feeling better. Maybe you cracked the bone. Is it that bad that it's any little movement hurts?
No.
It's not that bad.
Can I mention a ligament or a tendon pulled real bad?
Yeah, I mean, you can mention that. Tendons, ligaments, muscles, if they tear, they bleed. But, man, tell me again how you did this. You simply got up out of a chair?
Bed. In the morning.
And it hit you with a whack, huh?
Oh, I just rolled on my back and I jumped up and I landed on my left foot. I just like I wanted to kick start, get going. Yeah, unbelievable. Yeah.
I need to see this.
Yeah, I think it's medical history.
I think I need to examine you, maybe get a test, because it sounds more serious than a simple muscle tear to me. I mean, I'm not worried that it's something terrible, but to diagnose this, I need to have my physical examination, put my hands on you.
But you know what? I'm a bruiser. I bruise very easily. This bruised spot is about 6-7 inches.
Wow.
It's in diameter, all up in the left hip.
Yeah.
It's the area where like the muscle has been pulled from.
Mm-hmm. And have you seen your own doctor or had it x-rayed or anything?
I got appointment to see him. I thought it would go away, but...
Yeah. I think it's a good idea to see him. And let him take a careful history and let him examine you and tell you what happened. That's the way to go. All right?
What can be done for it?
Well, as soon as we know what it is, you know, there's an outside chance you cracked the bone.
Wow.
I know, because it's not likely, but what hurts when you simply bear weight on it without even moving? Well, a cracked bone hurts if you bear weight on it. Torn muscle, if you bear weight on that limb but don't try to move anything, shouldn't hurt. So I'm puzzled.
One question I'd like to ask: there's a tendon, muscle, and a ligament. And now, you think it's a muscle involved?
I don't know.
Oh.
I don't know. The tendon attaches the muscle to the bone. The ligament attaches one bone to the next. All of these things have a certain amount of blood supply, especially the muscle part, and could, if torn, could bleed and cause a big bruise. The blood supply of a tendon is not so great that you would get a 8-inch, 7-inch blob of area of bruising. Are you taking any blood thinners that would cause you to bleed extra? Aspirin, Plavix.
Yeah.
What are you taking?
Lipital.
No, that's not going to thin your blood.
Well, anyway, I just bruise very easy on my arms and legs.
Maybe that's just your nature. Maybe you have what's called fragile capillaries. Go see your doctor, George, and make sure they figure out what this is.
Thank you.
All right, take care. You're listening to Dr. Bernie Portner. The number here, 521-8383. Neighbor Island listeners can call toll-free at 1-888-565-8383. Those of you on the mainland or across cyberspace listening to iHeartRadio, I'm pretty sure you too can call 1-888-565-8383. So in contrast to last week, the calls are not flooding in this week. I took all my calls last week. I wish I had saved a couple for now. I wanted to talk about something that is not exactly orthopedic, but is very much sports medicine and is very much in the news lately, especially if you're a Michigan fan. which is short for fanatic, like me. And that is concussions in sports. And a concussion is a injury to the brain. And the brain, as you know, is the most important organ. In college, we used to say it was the second most important. But really, as adults, we know it's actually the most important organ in the body. It is us. And without a portion of the brain, you lose a portion of your ability to do things. If it's the portion of the brain that controls speech, you have trouble speaking. If it's the portion of the brain that controls coordination, you walk like a drunk. If it's the portion of the brain that controls mathematical calculations, you lose that ability. If it's the portion of the brain that controls the urine, you're urinating and you're going to have bowel movements, then you're going to have problems with that and accidents. If it's a portion of the brain that controls your legs, you're not going to be able to walk. If it's a portion of the brain that controls your eyes, you won't see. The portion of the brain that controls your hearing, you won't hear or smell if it's that portion of your brain. I hope you're getting the idea. Everything that we do, every sense that we have, every motion that we make, every emotion that we feel, it all comes from the brain. We are our brains. And it's very valuable, and it's quite fragile. It's a consistency of a hard jello, I would describe it as. It kind of wiggles when you shake it, and it's easily injured. And nature has placed this fragile but precious organ in a very hard shell called the skull, a bony skull, so that if you fall, the brain is protected somewhat. But I say somewhat. And when you get hit hard enough in the skull, it shakes up the brain enough and you get knocked out. You see stars. In high school, I played a little football. We'd get hit and we'd say, oh, I got my bell rung. I had some cobwebs. I saw stars. That was a concussion. And this brain injury never recovers completely. It's cumulative. And if you do it a long time, many times, you end up with permanent brain injury. And your thinking is less. You get Alzheimer's. Your mobility is less. You become unable to walk smoothly or far. Big problems. You can get depression. You can become violent. And we're seeing this in the newspaper all the time. And we'll talk more about this. There was a big to-do about a quarterback from Michigan that got a big illegal hit to the head, was clearly concussed. He was wobbly, couldn't stand up. And the coaches and the players and the trainers and the doctors and everybody claims to have not seen him, and they put him back in the game. A second hit to the head soon after a concussion can be fatal or very, very serious. So now everybody's talking about it. But I have a caller. Let me get back to concussions in a minute and take this caller. Ingrid, go ahead. You're on the air, and thanks for calling.
Hi.
Hi. What can I do for you?
I talked to you weeks ago about my pain in my left arm, and you told me to check and see where there was a bone doctor or something like that at the hospital in Hawaii. They don't have one. There is only one in Waimea. And I don't know if you said you couldn't remember his name. Did you, by any chance, remember him in the meantime? Because I still need some help.
On the Big Island, you're saying?
Yeah.
Dr. Soma. That's Maui.
No, that's not much.
Yeah. Doug Hiller. Hiller, I think his name is. Doug Hiller. Wow. I'm more surprised that I forgot that name that I actually finally remembered it. Doug Hiller.
Uh-huh. Now, is he just a surgeon or?
No, he's an orthopedic surgeon.
Yeah, I know, but I really, if I can help it, I don't want any surgery, you know.
Well, you want to talk to a specialist, though. And when you want to talk to an orthopedic specialist, 99 times out of 100, that'll be a surgeon. It doesn't mean he's going to recommend surgery, but at least he'll be able to hopefully diagnose your problem and tell you what you got. And then you'll know what your treatment options are. That's the key to any recovery medically, is to first understand what the problem is.
All right. Because in the meantime, I've had some acupuncture and some light treatments and all this, but it didn't help at all.
No, it almost never does. I use acupuncture in my office. It does help with pain. It does help with muscle spasm. It helps with people who are too anxious and are having trouble sleeping. It doesn't cure anything, although I know if my acupuncturist, Yana, heard me say that, she would argue with me. I don't really think acupuncture cures much. I don't think it's useless either. It can help in some cases. I don't know how. And in most of the things that we're afflicted with, we can heal up. So if anything, a pill, acupuncture, ice, if anything can relieve the pain while we heal ourselves, it's useful. But what you need is, because you've had this for so long, you need a diagnosis, and I bet you if you find Dr. Hiller over there up north in Kohala area.
Yeah, he's somewhere around here, so
yeah,
I will call.
You find him, tell him I said hello, and and get this thing diagnosed, okay?
Thank you so very much.
All right, you're welcome. Thanks for calling. You're listening to Dr. Bernie Portner, 521-8383. If you're on a neighbor island, you can call 888-565-8383. I was talking about concussions, which is a blow to the head causing an alteration in brain function. That is consciousness, vision, balance, mobility, and then it seems to clear up. And we all suffer concussions. I have a little granddaughter, Aviv, and she strikes her head all the time. She falls and bumps her head, and she's low to the ground and has a thick skull, so toddlers fall, and they got thick heads, and they only fall about 1.5 feet. So she doesn't really get knocked out. And these little concussions maybe don't end up with anything permanent. We don't really know. But we do know that when a player gets a concussion, gets knocked out, even briefly, that damage is done to the brain that will not recover fully. And then if you do it again, it won't recover fully. And when I say recover, what I mean is brain cell death. And by death, I mean irreversible loss of life. So cells are alive, and if you bang them too hard, they die, and they remain dead. And you have a brain problem. And, the sports that are particularly full of concussions, almost without fail, without exception, our dearly beloved American football. I mean, we put big, thick helmets around, but and that helps somewhat. But you don't have to hit or break the skull to get brain damage. A big strike to the helmet still shakes up that jello inside, and you get what are called contra-Q injuries. The brain gets injured not from the direct blow, but from the vibration and wiggling and jiggling back and forth within its own hard shell, and you still get injured. And it's hypocritical. It's a problem because I myself am a football fan. And you can look at football as a sport where concussions are the norm and even the goal sometimes. I mean, we celebrate great hits, and we know that all the players out there are targets and susceptible to serious injury, not just to their head, but also to the rest of their body. Now, if you injure your knee and maybe permanently have a limp, that's bad enough. A lot of people poo-poo that, say, oh, well, you're not dead, you're not dumb, you got a bum knee, and you're going to be an adult, and you're going to hop around a little, it'll give you character. But it's not like that. It makes life more difficult when you can't walk so well. But, okay, let's live with a bum knee, a permanent bum knee from football. But there's also neck injuries. That's permanent paralysis. Back injuries, permanent paralysis. And then these head injuries, which are often cumulative. So I know I'm going off on a tangent, and I'm not inviting many calls talking about this, but you can always interrupt me if you want to talk about shoulder or neck or hip or knee or back pain, but I think this is important. We had a retired NFL football player as a citizen of Honolulu. He passed away around Christmas time. His name was John Wilbur, and I guess I can talk about him now because he's now deceased. And he played in the NFL for many years. He was a lineman, I think an offensive lineman. And he was terribly beat up. And I knew him when he was newly retired in his 40s. And he was a hard liver, and he partied hard and enjoyed life. His knuckles were all bent out of shape. His fingers were really gnarly, literally gnarly. His knees were all bust up. His feet were permanently crippled. And it was, you know, he made a ton of money. He had a lot of fun. He played a sport. He had a lot of friends. And that was the consequence. But what else he had were a lot of blows to the head. And as he got into his 50s and 60s, he became like an Alzheimer's patient. He couldn't remember. He couldn't understand. He was confused. He would talk gibberish. I ran into him several months before he died over at a coffee shop after one of my surf sessions. And he had an attendant with him, someone just to help him get around. And we had a talk, and he could fake it a little bit, but he had Alzheimer's disease related to multiple concussions, and it's devastating. And if you consider the brain to be as precious as it is, then no way would you want you or your children to play this kind of sport, because why chance it? You wouldn't treat a fancy car this way. If you had an expensive Porsche, you wouldn't play Dodge car with it. And yet we have a very precious, priceless brain, and we play Dodge car with it all the time. We send our kids off with a big old helmet to bang heads. And football is not the only culprit. Soccer, of all things, is also, because we head the ball and we sometimes collide with other people. Soccer players from the heading are known to have a brain injury from multiple concussions. And of course, the biggest one of all is boxing, which the whole goal of the sport is to knock the other guy out, give him a concussion. And then we have a lot of brain damaged, retired boxers. Think Muhammad Ali. He got what's called pugilistic Parkinson's disease. Anyway, I'll talk more about this. It's a hypocritical thing, because how can you be a football fan and yet never want to play or have your son play football because of this? And are you cheering like a gladiator, like the audience cheered in Rome at the Colosseum when the gladiators killed each other? Is this just a little more civilized, sophisticated form of that with hockey? And we just we cheer at violence, I think, and we cheer at the risk of bodily injury, and it brings us to the NASCAR races and to the hockey games and the football games. Anyway, let me take this next caller. Chris, go ahead. You're on the air, and thanks for calling.
Hi. Good morning. My name is Chris, and I'm from Kauai.
Yes.
And I'm a past customer, you could say, of yours.
You could say
20
patient.
Years ago, you helped me out.
Yeah, patient.
Yes, patient. Thank you.
Yes.
So
I hope I was helpful 20 years ago, if you recall.
Well, yes, and that's why I'm able to do what I can do today.
Oh, good. That's good to hear. I did somebody some good. Yeah.
Thank you. And that's why we listen to you. My wife listens to you every Saturday.
Ah, good. I'm glad.
Enjoys your program.
Thank you for
now,
that.
Our concerns, my first question, I think, would be, do you have archives on your programs that people could listen to in case they miss the opportunity?
Yes and no. The shows are recorded and they are archived. They're not readily available to the public. We use them for the 6 to 7 show. On iHeartRadio, you can hear it live. On the website, KHBH website, they used to archive shows. So I don't know if that's still happening, but to answer your question, I don't think so, and if so, not much.
Okay.
Yeah.
Because these concerns come up as you mentioned them, and I think that what you were just talking about is really the principles of all things. It appears to be the truth of the way our society is, and unfortunately the injuries that go with it. We have a 12-year-old grandson that is taking up competitive boxing, and after hearing you this morning, it brought to our attention. Here's a concern that we need to think about.
Yeah.
So we pretty much heard what you said. I called my son and asked him if he would listen to your show, but I don't know if he is or not.
Yeah.
That's why I was asking about archives.
Yeah. No, I don't know that this show is archived. I think if you like, if you email me.
Okay.
Email me. I'll get a electronic file of the audio of this show, and it'll be available for 6 days on this cloud-based file system, and then it's erased. So if you email me.
And what is that, sir?
You can email me at info.
INFO?
Yeah, at PortnerOrthopedic.com.
At Portner Orthopedic. Orthopedic is spelled
ORTHOPEDIC.
See, that's how long it's been since I had to see you.
Yeah, orthopedic. Yesterday I couldn't spell it. Now I am.
Okay, that's info at PortnerOrthopedic.com.
And in the subject, put radio archive, and I'll know just what it is. And then when I get the link, I'll share it with you, and you can download it.
Okay.
All right? But imagine you had a very precious glass blown piece of art, like a vase or a $100,000 Russian glass egg that was very fragile, was worth $1 million, and was an heirloom. And how would you take care of that? Would you put it on top of your head and play football and maybe break it? No. Well, the same can be said about the brain, because as precious and expensive and fragile this heirloom Russian glass egg might be, the brain is 1,000,000 times more precious and more valuable. It's priceless, and yet we put it on our heads and we hit people with it. So while boxing is a great sport in many ways, you're putting your son in grave danger in terms of permanent head injury over time. And it's a dumb sport for that reason. And the same could be said about football. And the same, frankly, could be said about soccer, which you think not, because you can run around. It's a great sport, team play. There's no helmets. You don't really hit each other's heads. In football, we're talking about a violent collision ballistic sport. In soccer, it's not like that. But we head the ball, and that shakes up the brain, and that ends up causing problems. And, with the kids, they put on headgear, which blunts the blow slightly, but you still shake it up inside. So there's no way you can be a boxer at any level and not incur brain damage. There's no way. Now we can absorb plenty of brain damage. That's the thing, because you take a 12-year-old and he's going to be, I don't know, let's say he's hasn't had many hits to the head, and he's going to be an all-A student. And then he gets involved in boxing, and he gets some hits to the head, and he's got his gear on, but he sees stars once or twice. It's normal. And he does this for a few years, and he gets out of high school. He's got a B average. How do you know? How do you know that it's a tough thing to do? So because it's so precious, you wouldn't take a chance even with this precious glass egg. Why would you choose to take a chance with that? Now, you can do a lot of other similar sports and decrease the risk of head injury. You can't eliminate the risk of head injury. You could just fall downstairs and get head injury. So it's there anyway. But if you pick a sport like, for example, other forms of martial art, instead of boxing where the head is actually hit, there's plenty of martial arts, especially here in Hawaii, that don't involve full contact. And you can learn how to defend yourself. You can get into good shape. You can learn how to throw a punch. You learn how to block a punch. You can learn how to throw a kick. You can learn how to block a kick. You can learn how to, live the way of a warrior and not take blows to the head. And many, many dojos, martial arts dojos, are not full contact. They're not trying to knock people out. So that might be a better alternative to boxing.
More respectful.
Yes, and more respectful to the brain. And we should definitely respect the brain because that's who we are, 100%. Everything else can be replaced almost, but not the brain. So I think it's dumb. I think it's actually negligent on the part of parents to put their kids in that position. Just like they wouldn't put that family heirloom glass vase in that kind of position. This is much more precious than that. But
may I ask you this?
Yeah.
Well, I agree. May I ask you, because I think so many of us listeners to you agree with what you're saying. This week we would have the opportunity to talk to our children and our grandchildren and discuss this issue. Would you seriously consider with maybe next week talking about this a little bit? If it's would you consider that?
I would. I mean, I'm talking about it today. What prompted it is I'm a Michigan college, University of Michigan football fan, and our quarterback got dinged big time, had a concussion, and it was missed, and he was put back in the ring basically. And now there's a big hullabaloo, fire the coach. Of course, he's not winning. I'm sure if he was winning, they wouldn't be shouting fire the coach. But now it's just another excuse, and whose fault was it, and why was it, how could it possibly be missed with this day and age with, 10 different angles? I mean, it was clear to me when I saw not just the hit, but he wobbled and almost fell afterwards, that is a concussion. And now I'm a physician and I recognize concussions, but you don't need a weatherman to know which way the wind blows. I mean, if somebody's staggering, there's a problem there. And that's sort of why I brought it up. And it's in the news and wherever you look, but it's our society that we crave this violence. And I enjoy it, but I would never let my son play football. And not only bad for the brain, but it's bad for all the other joints. And when I say that to other colleagues who also are sports medicine specialists, one of the answers is, well, they're going to do something after school, and that something is likely to be dangerous to some extent. At least this is supervised. There's a grain of truth there, but best to do something supervised that isn't so violent and ballistic and doesn't disrespect our brain and our body. So, yeah, I what I'll do is if you send me an email, I usually get the file on Monday or Tuesday. I can send it to you, and then you can just play it back. Because one thing this conversation is not doing is generating a lot of callers, which means maybe a lot of people are turning off. I'm not talking about my usual orthopedic aches and pains. So I don't know if I'll do this again next week, but if you have the tape, it's not really a tape, it's a file, you can play it for everybody. And maybe have a discussion, and I'm not the world's authority on this, but the bottom line is this. You have a very precious item, your brain, that means everything to life, and when it gets injured, it stays that way, and it can tolerate some, but you lose a little bit every time, and eventually you can have very serious problems. So boxing, football, I'm sorry to say soccer. Now, with kids, soccer, they're more and more trying to not teach headers. But if you're good at soccer when you're a kid, you'll go up the ranks, and in high school they do headers, and headers scramble the brain.
Yes.
So it's not such a good thing. I think we have to do activities that don't necessarily, unavoidably, injure the brain. Bad enough if something happens accidentally. So I don't know. I'm going to watch football today at 1 o'clock. My team is playing. And I have mixed feelings about it. Because what am I doing? I'm cheering for these kids that are putting their life on the line. Yeah, a little bit of a gladiator thing. And maybe we're hardwired for that. Maybe we need that,
Oh, I tell you truly. We live on Kauai and, basically up country, and a lot of chickens around and animals, and we observe them, and it seems to be in the nature of man and animal to be this way.
Aye.
But we do have the consciousness to not be this way, but we don't usually use it.
Yeah, well, individually we can. Maybe your son will.
I hope so, and thank you so much.
All
truly.
right. It was an interesting
Enjoyed the great help.
All righty.
Aloha.
Well, I don't know. We talked about everything but orthopedics today. There is another 5 to 10 minutes here, 5 or 8 minutes. So there's time for perhaps another caller or two. 521-8383. Yoga is something I've been doing lately over in Manoa. Iyengar Yoga on the second floor in Manoa Shopping Center. I guess I'm giving them a free plug. I really love the outfit. I don't want a lot of people going there because the classes will get too crowded. But they do a very, very good job. And yoga generally is a very healthy activity to do. So it's something you might want to do. But not like everything else. It's not perfect. You can injure your ankle like I did by trying too hard. You can injure your back, or if you have a back injury or a knee injury, you can aggravate it. So something as healthy as yoga has to be done carefully. But you're not likely to injure your brain, which is the most precious thing. And that's something I've gotten into again. I see I have another caller. Let me take the caller before I ramble. Johnny, go ahead. You're on the air, and thanks for calling.
Oh, hi. Just a comment since I'm in marketing. You really need to throw your phone number out more often because I was sitting here very frustrated.
Oh, sorry. Yeah, it's a dilemma for me because you're right. I have to say it more and more and more. Is there something else you want to help me with?
Oh, yes, of course.
Go ahead. I really appreciate that. I just want to say, I listened to we taped this show and we use it again for the 6 o'clock show later on. And then it's not good to throw out the number because it doesn't work. And people are listening to a taped show and they hear me say call this number. And if they do, they get a busy signal because it's a taped show. So I try to do we try to do the numbers during a break, but I'm taking fewer and fewer breaks, and I appreciate it, and I will say it more and more. Go ahead. What else can I do for you?
Excuse me. Yeah, I'm 67 years old, extremely athletic, and 7 years ago I screwed up my knee on a stair climber, and ever since they say I have an inflamed meniscus. Excuse me. And now the pain's so bad, it threw off my gait. My right foot's out at 2 o'clock. It's screwing up my hip. I'm limping. The right leg is now shorter. And I don't know what to do. I'm not one for medication and surgery.
Right. It's a long time, 7 years, to have a swollen meniscus. So I guess if you injured a meniscus, it could be swollen for a couple of weeks, a couple of months. But 7 years later, that's not what this is. The fact that your foot is pointing out to 2 o'clock, that's not coming from your knee. That's coming from your hip, most likely. So you hit upon it. You also have a hip problem as well as a knee problem, I suspect. And you've had an MRI, I take it, of your knee, and they say all it is a swollen meniscus. You didn't tear anything?
No, that's the thing I'm frustrated about is, first of all, you're right about the hip, because I also had an MRI on the hip, and they said it's degenerative.
Right.
And I'll probably need a hip replacement eventually. Now, regarding the knee, it's not swollen. It's never been swollen. It's just a horrible burning sensation right underneath the cap on the right side, and it's very painful when I step. And so I don't believe it's an inflamed meniscus. I believe something else is going on.
Right. I think I agree with you. When you say underneath your kneecap, do you mean below it or you need behind it? The burning sensation. Is it below the kneecap towards the foot or behind the kneecap towards the back of the knee?
Excuse me. At 2 o'clock on your knee, there's a hole you can stick your finger in, and that's where the pain is.
Uh-huh.
Okay.
I see. So I agree. I think that from what you're describing, this may not have anything to do with the meniscus, and should be re-examined maybe. I think there's hope, though. You're only 67. That's the new, 47, and you're active. And why not? You have osteoarthritis of the hip. There's treatments for that to stave off the eventual surgery that you may end up needing. But there are treatments between now and any time you're going to have a hip replacement. Hopefully, you can put that off 10 years or more. And as far as the knee goes, there may be something that was missed diagnostically. They took an MRI back when you injured it. They saw a swollen meniscus, and they said, that's the problem. And now you're still having this burning
Thank you for
pain.
listening to the Moving Body. Hope
Yeah,
you enjoyed the show. Remember, if you're having problems with your arms, leg, neck, or back,
a Vietnam veteran,
you'd like to get an appointment over at the office on P.E. Coy Street, you can give us a call, 596-7300. We're open 6 days a week and have a full line of doctors, therapists, EMG, and a great office staff to assist you. We try to respect your time like we hope you respect ours, so people are seen on time. You don't have to expect to spend the whole morning if you have a 9 o'clock appointment. We'll try to see you right then and there. Remember the warning signals that I talk about throughout the show off and on. If someone tells you that it's only your age to live with it, that the x-ray is normal, nothing's wrong, that it's, quote, arthritis or bursitis or tendonitis, but they haven't really examined you very carefully, be cautious about that. Ask for another opinion. If you're told to have surgery, ask for another opinion. If you're told nothing else can be done about it, you want to say, well, maybe you can refer me to another specialist. Maybe they have a better idea. Don't just accept those kind of things. Don't forget to tune in next week, same time, on KHVH. Go out there and exercise this weekend. It's the single most important thing